What's up everybody? My name's Oz, this is Big Swing Golf, and yeah, I haven't been around in a while because yeah, unfortunately I've been diagnosed with golfer's elbow, probably because practice loads, I weight train, even though it might not look like it, I do, and yeah, I've not been able to play because it causes me too much pain. So today I'm hoping to find out some answers. I am here at South West Osteopathy, and I'm here to meet Oliver Newy, who's hopefully gonna A, explain to me what exactly golfer's elbow is, B, how it's caused, and see how we can fix it, and we might have some other little caveats of knowledge in there as well. So please stay tuned and let's get into it. So Ollie, thank you for your time today, really appreciate it. Could you just explain to us first, and I know everyone out there is wondering, what exactly is golfer's elbow?
So golfer's elbow, generally, you got golfer's elbow and tennis elbow is commonly what they're known as. In terms of a clinical diagnosis, it'll be more medial and lateral epicondylitis or epicondylalgia. Generally that will be, the tendinitis is kind of classified more as a tendinopathy now. Right. And what that means is itis is inflammation and opathy is more like an overuse of the tendon here.
Right, okay. So a lot of us out there, probably a lot of all of that encumbered. Is that quite common?
So yeah, I'd say in terms of like tendon use, overuse, muscles, tendons, generally that's probably one of the most common things we see. Okay. So it's generally people who are in professional sports, who generally have an active lifestyle, or runners, generally people who haven't done the activity and then return into activity. So they get like a sudden spike of load to the tendon. Right. Then the tendon becomes a bit overloaded, a bit unhappy, and then it sends signals like, oh, this is quite sore.
I'm currently running through my head like, I'm not a professional athlete, I'm not any good at anything, so how have I got this? But I'm sure there's sub-explanation somewhere. So thanks for that, Ollie. What causes golfer's elbow? How have I got this?
Golfer's elbow is very common, so you don't have to be a professional golfer or professional athlete to get it. So it can be anyone, and it can be from the most simple tasks. So generally, if we get exposed to overloading, so over-stimulus within that tendon, it becomes a little bit unhappy. So it could be, for instance, gone to play golf, if it's 100 shots you've done, and then gone to...
Or more.
Done some driving, or gone to the gym and you've just done too much or got a spike of it. So then that creates a bit of an unhappy tendon, and generally with the tendon, it normally comes in within sort of a few weeks.
Right. I got a bit confused online because I was reading, oh, you've got golfer's elbow, or my fellow golfers were telling me I've got golfer's elbow, but the internet out there is telling me I've got tennis elbow. What's the difference between golfer's elbow and tennis elbow?
So generally, as they're commonly known as golfer's and tennis elbow, generally the kind of clinical difference is tennis would be outside of the arm here. So anatomically, be standing like that. That is the outside, and that would be the tennis elbow. Right. Okay. Golfer's inside here, but generally, I know we call it tennis and golfer's elbow, but generally, if you're a tennis player and you're playing forehands, yes, you might get stuff like tennis. And if you go backhand, you might get golfers. So it doesn't necessarily say, it doesn't specifically, you play tennis, you'll get tennis elbow. Right, okay. If you play golf, you won't get golfer elbow. So clinically it's more medial, so inside, and lateral epicondylitis, well, the tennis elbow and golfer's elbow in terms of those two pathologies. So they are the same pathology of injury, it's just one's differentiated between the inside and the outside of the elbow.
And what are the symptoms of both?
So symptoms generally we get from, if we're looking at tendinitis, tendinopathies, it's generally tender around the tendon. That's the kind of the common aspect. But in terms of when you get pain, generally can be quite diffuse around the area, and sometimes it can kind of refer down, because generally if it's the muscles here, so the flexor and extensor of the arm, they'll be connected to the tendon up here. Right. And so you can get quite sore muscles as well coming down. And if the joints integrity is good, then if we're just talking about tendon, you might be kind of quite different.
And actually I did read as well, and you might be able to clarify this, and that would make sense now, my grip felt tighter?
Yeah, so generally if you've got these tendon issues as well, and that is one of the testings we do, is to test grip strength as well.
Okay.
And then if that's one of the testers we're testing, we use that as a tool to retest it later on. So if you're coming in, let's say you're in the end stage of your rehab on exercises, we test that again, and then we can see if your strength has improved,
okay,
or in some cases regressed.
Okay, perfect. So that's something, that's the kind of identify for the guys at home as well. If they're feeling differences in their grip, that could be a sign that they are hitting too many balls and might need to come and see you and get some treatment.
Yeah, so if we're specifically talking just on tendinitis and tendinopathies and tendon pathology, yeah, that could be related. But generally, other aspects, if you've got neurological issues like pins, needles and numbness, that might not be coming from the tendon, that might be something else, then I would definitely go to a healthcare practitioner. So.
Okay. In your opinion, would a super thick grip like this prevent golfer's elbow, arthritis in the future or currently?
I think as an amateur golfer myself,
yeah.
But no, I think generally with a thicker grip or a thinner grip, I don't think it will make too much of a difference in terms of the pathology of injury, because it's generally when we are going through when we're hitting the ball, generally it depends on the exertion you hit it, the power and etc. So if you're hitting something explosiveness or high explosiveness, that might irritate it. So in terms of that, it won't make too much of a difference if it's thinner, thicker. In terms of arthritis, if we're specifically looking at osteoarthritis, which is more traumatic based, I wouldn't say there's any common or any that much evidence to suggest thicker or thinner. But in terms of if you're work in an industry which has high vibration, this is quite a common issue where you have high vibration, which can irritate again the kind of flexor and extensor or the tendon as well. Potentially there's some equipment out there which I'm not sure on, but you can have a look at that and see what's out there.
Explore that. So in terms of, so it would generally be down to comfort then, in your opinion, like if it's comfort of the grip in your hand, if you are suffering with something that is affecting your grip potentially, arthritis, the thicker grip could potentially help you just comfort wise. I
think in terms of grip, I think clubs as well, it's personal preference, and if you find it helps you with your game, if you're improving with other clubs and your performance, brilliant, crack on.
So Ollie, what can we do here at South West Osteopaths to get me out on the course quicker?
So generally, what we do, we go through obviously the treatment and the rehab plan, what we spoke about earlier. Also, we have also another procedure we can use here, which is shockwave therapy, which is essentially at the moment gold standard to treat tendons.
Okay.
And to basically get the best effect from shockwave therapy is actually combine it with rehab therapy as well.
Okay.
So we have shockwave therapy, which is a non-invasive shockwave procedure which directly goes into the tendon.
In terms of like time frame, how long is it going to be until I can get back on the course and hit some balls?
So generally, it generally depends on the individual, because I think one treatment doesn't suit all. There is other ways we can effectively treat someone, and it depends what they're coming in with as well. But effectively, if you're going through, let's say, a shockwave aspect, we'd say come in for 4 to 6 treatments of there. So effectively, we could get you back onto the course within that time frame.
Or the court.
All that. But yeah, so generally, it depends obviously how you react to the treatment and the loading as well. So, but generally, we like to get everyone back on as soon as possible. But it's very dependable how you
how I react to it. Right guys, that's the end of that. So Ollie's given us so much information. Thank you so much, Ollie, for joining us today. We really appreciate it. I'm going to start going through all the exercises that Ollie's going to give me. I'll give you updates as we go. We're going to post some updates in terms of my recovery, and I'm also going to jump on Ollie's channel and do some bits on there. By the sounds of it, he's going to put me through some pain. So if you've got any questions, guys, get in the comments below, okay? My name's Oz, this is Big Swing Golf, and I'll see you next time.